At MedStar Good Samaritan Hospital, the new collaborative care program at the Good Health Center is a comprehensive chronic disease management program featuring 16,000 square feet of newly renovated patient care space designed to provide innovative patient and family-centered care to those living with multiple complex chronic conditions. The new program will address the many needs of this vulnerable population by providing coordinated specialty care managed by an intensive core medical team who understand each patient's unique conditions and proactively provide the treatments needed to maintain the best health possible. This expansive facility features 16 modern exam rooms, each oversized to accommodate the full care team, along with patients and family members in privacy and comfort. Each room includes a dedicated team meeting space to bring caregivers and specialists to the patient to collaborate at once during the patient visit. A wall-mounted plasma screen allows your primary care physician to join the team remotely, ensuring critical decisions can be made in real time and aren't limited by various staffing schedules. Patients' appointment times will be maximized by allowing for needed tests, procedures, and consultations without having to go to different locations at different times. The collaborative care program also features family and caregiver consultation rooms, infusion and lab areas, a gym, community learning center, and a food pharmacy. Using an evidence-based approach proven to improve clinical outcomes, patients will receive one-on-one consultations with a dietitian in the center's food pharmacy and be provided with healthy food options specifically tailored to their individual needs and chronic conditions. Program support services also include social work, financial counseling, and lifestyle coaching, all in one convenient location. This innovative approach to managing complex chronic diseases will provide our region a much-needed resource. An important component is proving this model, measuring impact and outcomes, and identifying best practices. The Health, Economics, and Aging Research Institute at MedStar Health, located adjacent to the Collaborative Care Program, is a laboratory for innovation and research designed to evaluate the program's performance and patient outcomes. This suite includes 3 patient exam rooms, a research laboratory, and administrative space to allow collaboration with the clinical care teams and to engage patients in clinical research to test new treatments in chronic conditions and evaluate the impact of these treatments on cost of care. The patient pathway experience plays a critical role to increasing patient satisfaction, efficiency of care, and addressing the multiple complex needs of each patient. When patients arrive at the Collaborative Care Program, they are welcomed by a friendly, caring staff and immediately escorted by a medical assistant to the exam room. As part of this program, patients are registered and all paperwork is completed in the comfort of their own room. Prepared with all necessary medical equipment, these rooms allow patients to remain in the same space, beginning with initial screenings and throughout the entire visit. The program highlights our ability to bring your provider, medical team, and specialty services together in an environment designed to be warm and welcoming, not clinical. Medical staff joins the patient and family in coordinating the customized care plan for each individual. All critical team members can provide input and receive feedback on the continuum of care plan alongside the patient. Through this comprehensive model, we can address a wide variety of care needs, both medical and social, culminating in management plans that are as unique as each patient we serve.
The concept of the collaborative care program came from a lot of my own clinical experience with my patients. One of the frustrations that patients have is they often get farmed out to lots of specialists and have lots of tests. It requires them to take days off, it requires multiple visits, transportation, etc. And many of our patients in the surrounding catchment area around MedStar Good Samaritan Hospital really do not have the ability to take that time off. The kinds of patients and their illnesses that we're looking at are heart failure, diabetes, and chronic obstructive pulmonary disease, to name the 3 most significant ones that not only affect our community, but affect the community at large significantly. And so we know that these people are going to need the expertise of endocrinologists, of pulmonologists, and of heart failure doctors, not just cardiologists, but doctors who are specialists in heart failure. And having them collaborate together and making sure the medical regimen is consistent with all their diseases is quite important. And so I'm sitting in the central core that was designed specifically to be open, to enhance collaboration, so that our patients can see that healthcare providers and staff are communicating about the patients, and to show that this is a team sport. It's not just one person directing the care.
In chronic disease management, we recognize that multiple social determinants of health are crucial in the positive outcomes for our patients. To that end, we have designed this program to identify and assist with these concerns. Community health advocates are in place to identify at-risk patients and address needs such as housing, nutrition, transportation, and safety. Dietitians are on staff to help address food insecurities and provide access to nutritional food via the Food RX program.
Healthcare is about this much the medications or the surgeries or the clinic visits, and about this much what's going on in the social situation. And so what we wanted to do is really address the full patient and get to the root of their health problems. And so that involves addressing the social drivers, which in this case is access to healthy food. When a patient comes into the Collaborative Care Center, they'll meet with their team of physicians, physician assistants, providers, and then they'll also meet with our community health advocate. The community health advocate will screen the patient for food insecurity. If a patient screens positive, they'll then be referred to the Food RX program. At the Food RX program, they'll meet with the dietitian, and the dietitian will work with them to provide education around healthy food and cooking and nutrition. So this program is really the first of its kind in the state. This program is more than just a food pantry because it's embedded within a health system, and the meals will be specifically medically tailored to the patient's chronic health conditions. Right now, we're able to reach 10 patients per month, and then the following month, reach 20, and then from there, 100 over the course of the next year, and then beyond after that. So the reason the HERE Institute is so important to this program is that ultimately we need to show the impact of the program on the patients. What we want to do is continue to evaluate and monitor our impact on patients by looking at utilization metrics such as ED visits and hospitalizations, as well as impacts on their overall health, such as the impact on hemoglobin A1C or HbA1c and their weight. If we're able to prove an impact on this, that gives us ammunition to go back to the payers and the health system providers to then request funding for this program long-term and make it sustainable. This program was really possible thanks to the generous contributions of our donors and foundations that are helping us to support this program as really a proof of concept. What we hope to show long-term is that it has a real benefit on our patients' health as well as their utilization, so that then we can continue to fund this program long-term.
Individuals with complex chronic conditions face numerous challenges managing them. Living with a chronic condition involves a continuous process of balancing the demands of illness and the demands of everyday life. The new Collaborative Care program provides an environment and platform designed to support the delivery of exceptional comprehensive care with a dedicated research component supported by the HERE Institute investigators to evaluate patient impact and outcomes. Together, this innovative approach has now created a destination unlike any other.